from the station working for you. This is an RTV6 special report.
Somebody's phone's up here. Good afternoon, everyone. I think we'll go ahead and get started today. Jenny, you're good, right? If we start? Okay. Oh, yes, sir. Absolutely. No worries. You're welcome. Everybody good? All right. Thank you guys for joining us today. As you know, COVID-19 is once again on the rise in Indiana and across the country, and we're seeing levels that we've not seen in some time here in the state. Many of these numbers resemble what we saw about this time last year. A year ago today, we reported 900 cases per day. This week, we're averaging more than 900 cases per day. A year ago today, our positivity rate was 6.6. After seeing our rate decline to just over 2% in late June, today we're back up to 6.8%. The number of new cases per week also has bounced back up. We are well below 2,000 cases a week in June, or we were, but we're seeing 4,000 to 6,000 cases each week right now. This is still a vast improvement for where we were at the beginning of the year, but it is not the direction, obviously, that we want to go. While this might seem like deja vu, I want to remind you that much has changed over the past 12 months. A year ago, we had very limited tools at our disposal to protect ourselves and others from COVID-19. Masks, social distancing, and hand washing was really the only things in our arsenal. Today, we have the most powerful tool available to prevent disease in the form of 3 highly effective vaccines. But almost half of eligible Hoosiers still have not received a single dose of a COVID-19 vaccine. A year ago, we were dealing with one strain of the virus that caused COVID-19. Today, we're battling multiple variants, but the biggest threat is from the Delta variant, which is fueling our current increase in cases. This variant, which was first identified in India, spreads more than twice as easily from one person to another compared with other strains. The CDC has compared the infectivity of the Delta variant to that of the chickenpox and measles, which means that each infected person can infect an average of 8 or 9 other people. It has surged to become the predominant variant nationally and in Indiana since May and represents more than 90% of the samples we sequenced in July. Keep in mind that not every positive COVID case is tested to see if it's a variant. New data show that people who are infected with the Delta variant have higher viral loads. This means that they have more virus in their body than people who were infected with previous variants. We are seeing this in many of the long-term care outbreaks that are currently happening. The majority of those cases involve the Delta variant. The increase in the Delta variant has led once again to an increased demand for testing. The number of COVID-19 tests being done has risen significantly since the end of May, and we're back to testing upwards of 13,000 people per day. The number of people currently hospitalized with COVID has also increased. Nearly 8,000 people across the state were hospitalized with COVID this week, which is higher than we saw a month ago. Daily admissions also have shown an increase lately, but remain well below our peak. Hospitalizations are still far below our peak in December and January, and we are grateful for that and credit vaccines for much of that decline. Thankfully, the number of deaths remain at the lowest levels we have seen in many months. However, we also know that deaths tend to lag behind hospitalization data, so we're monitoring this closely. Any preventable death is one death too many to our mind. As we have done throughout this pandemic, these latest developments require us to pivot. This week, the CDC issued new guidance recommending that everyone aged 2 and older wear a mask in public indoor settings in areas with substantial or high transmission of COVID-19, even if they're fully vaccinated. The Indiana Department of Health is strongly urging Hoosiers to follow this guidance. This also applies to students, staff, and teachers in our K-12 schools, regardless of the level of community spread. The CDC also issued new recommendations that any close contacts of a positive case get tested 3 to 5 days after the exposure, even if they are fully vaccinated, and they should wear a mask until that test comes back negative. The recommendations also say that individuals should continue to wear that mask for 14 days, or as I mentioned, until the negative test is received. Because this is a new recommendation, let me repeat it. If you are a close contact, get tested, even if you're fully vaccinated, even if you're asymptomatic. If you become symptomatic, even if you're fully vaccinated, get tested and wear a mask until you are symptom-free and you have a negative test result. This change in guidance reflects the increase in COVID-19 activity that is being fueled by the Delta variant and the fact that vaccination rates are still low in many populations and areas of the country. With schools coming back in session at full capacity, I encourage every district to follow these recommendations. These are now local decisions, but the guidance is universal. We all want to have a full return to in-person learning with minimal disruptions and outbreaks, and believe that layering our mitigation strategies such as masking and vaccination, contact tracing, isolation, and quarantine will allow us to achieve that goal. I also need to once again remind everyone that COVID-19 is a communicable disease that must be reported to the state and local health departments, and that isolation is required when an individual tests positive. Yesterday, I updated the State Health Commissioner order regarding reporting of positive cases to specifically state that all K-12 educational institutions are required to report all known positive COVID-19 cases in students and staff. This should be done immediately upon learning of the positive test result. Let me be clear. A positive individual must isolate and cannot return to school or work until the isolation period is over. Cases must be reported to local and state health departments. I understand that contact tracing and quarantine and isolation place a burden on schools and businesses and families, but they exist for one specific reason: to prevent further spread of disease and to save lives. And in my mind, and Dr. Weaver's mind, to keep our schools open. Failure to contact trace or quarantine and isolate those who test positive or have been exposed but are not vaccinated increases the risk that more people will become ill, perhaps even with severe consequences. I know that everyone is tired of hearing this. I see it in the faces of my public health colleagues, in the healthcare workers, and in our first responders who have logged incredible hours and sacrificed so much of their lives to save others' lives. I'm incredibly proud that they continue to dig down deep to fight this battle. Please help them. Please follow the CDC's recommendations and get your vaccine, especially if you live or work in a congregate setting like a long-term care facility, a school, or a correctional facility. Next week, we will be adding data to our long-term care dashboard that shows the percentage of residents and staff who are fully vaccinated by facility. This information will be taken directly from the CMS data, which lags about 10 days behind, so keep in mind that it is not an every 24-hour data report. I know many Hoosiers have different beliefs about masks, the vaccine, and the pandemic as a whole. What I hope is that we all share a personal responsibility to do no harm to others. Until we increase our vaccination rates, and unless we use every tool available to us to stop the spread of disease, this virus will continue to have the advantage. It will continue to mutate, and we will be constantly playing whack-a-mole for the foreseeable future. I personally do not want to play games with Hoosiers' lives. It's all up to the rest of you and all of us to stop this pandemic. Now Dr. Weaver has some additional comments.
Thank you, Dr. Box. When the COVID-19 vaccine first became available late last year, supplies were limited, and we had to prioritize vaccine eligibility based on who was most vulnerable. We saw our elderly residents flock to be vaccinated, and it was incredibly energizing to see. But as vaccine has become more widely available and eligibility has opened to anyone age 12 and older, demand has fallen off. We knew that this would happen. Unfortunately, it is happening when we are seeing a resurgence of cases due to the Delta variant. We measure vaccine progress one shot at a time these days, and we are still seeing that progress, although it is at a much slower pace than we would like. Last week, we saw the highest number of first-dose vaccinations since the end of May, and since the beginning of the month, the percentage of fully vaccinated individuals has increased among every age group. The biggest increase has been among our 12 to 15-year-old age group, which has gone from 17% fully vaccinated to 21%. The next highest increase occurred among Hoosiers aged 16 to 19, where more than 34% are now fully vaccinated. Every shot in the arm is a reason to celebrate, and we will continue to go on to county fairs. We're at the Indiana State Fair, to the Brickyard 400, and to local festivals to provide the opportunity to get vaccinated. We continue to offer to partner with schools to provide vaccination support, both for the COVID-19 vaccine and for routine childhood immunizations that have been missed over the last year. Each one of those efforts means that more people are protected from diseases that are easily preventable. Just this week, more than 150 people received a vaccine at one of our 4 mobile vaccination clinics on Wednesday. Last week, more than 200 people were vaccinated at 6 mobile vaccination sites. Even so, many Hoosiers are still in that nearly 50% population that hasn't received a dose. Some are still fearful about the vaccine. To those, I say, research credible, science-based sources. These are the most studied vaccines given our robust event monitoring systems and the fact that millions, including almost 3 million in Indiana, have already received this vaccine. I encourage you to talk to people who have gotten the shot about their experience. Find someone you trust to discuss your fears. And if you need someone to hold your hand for your vaccine appointment, find that support person. Others think that they are invincible, or that if they get COVID, they will have a mild case. While it is true that if you are young and healthy, you most likely will do okay, but that is not always the case. As is evident in the stories we all see in the news of people who are fighting for their lives this very second in ICUs in Indiana. We also have started to hear concerns about breakthrough cases, with some people questioning whether the vaccine is effective, if they would still end up getting COVID. I want to stress that breakthrough infections for vaccinated people are still very low and tend to be mild. But we are finding that they are more likely with the Delta variant than they are with any of the other strains that we have seen. No vaccine is 100%. We hear every year from people who have received the flu vaccine but still get the flu. But vaccines do prevent many cases of illness and are especially effective at preventing hospitalizations and deaths. 98% of the new COVID-19 vaccines we have seen since January are occurring in people who are not vaccinated. 96% of our deaths have occurred in unvaccinated individuals. While we have seen 3,710 breakthrough cases among more than 2.9 million fully vaccinated Hoosiers, only 161 of those have been hospitalized, and a total of 56 have died. Those deaths have been in the same groups that we have seen to be at risk for this disease all along. Over 93% of those deaths have been in people over the age of 65, and the mean age is 79. However, by far, vaccines are still protecting those that are most at risk, as evident by our most recent 9 long-term deaths, where only one of those individuals was fully vaccinated. Breakthrough cases make up just 0.126% of the individuals who are fully vaccinated. Since January 1, your odds of getting infected with COVID, if you are immunized, is 1 in 892. Your odds are 1 in 14 if you are not vaccinated. Your odds of being hospitalized if you are vaccinated are 1 in 18,795, but they become 1 in every 237 people if you develop COVID and are not vaccinated. Finally, I want to remind you that you will be seeing changes to the county vaccination rates on our dashboard next week. These changes are the result of individuals being misassigned to the wrong county if their zip code straddled county lines. About 3% of all vaccination records were credited to the wrong county because the automated system assigned counties only looking at the zip codes and not the full addresses. While this is a small percentage of overall records, the correction will have a significant impact on some counties. 5 will see their vaccination rates increase by 5 percentage points or more, and 5 will see their rates decline by the same margin. We have taken steps to add an additional geocoding filter so that records going forward are assigned by their full address. But no matter where you live, the COVID-19 vaccine can help you keep you safe. We are grateful that more than 2.9 million Hoosiers have trusted the science and have gotten vaccinated. Encourage those who are still waiting to join them.
We'll be happy.
Questions?
Yep, take questions.
Okay, our first question comes from Steve with KPC Media.
Good afternoon. How are you doing today?
Doing well, Steve. Thank you.
Yeah, thank you. 2 questions here. First, I think as Dr. Weaver mentioned, we've seen an uptick in people coming in to get their first vaccine. Lately, it's not anywhere close to where we were April, May, but I'm wondering if you think there's a connection there between, the rising cases and more people now deciding to, step over the edge there and get their shots. What was my other question? Well, let's just hit that one today, I guess.
So yes, we agree with you. We have seen that uptick in people going out to get their first shot, and we do believe it's because people are seeing others be infected, and unfortunately seeing others get sick. And we wish it really didn't come to that, but we do believe that is a big motivation behind people going out and getting vaccinated. And we also know that there was a part of the public who just wanted to give more time, and so I think that they're saying, wait, the vaccinated people are protected, they are doing better, so really the time is now.
Do you think of your other question?
No, sorry, I lost it. Thank you, though.
That's okay.
All right, next question from Kristen of Fox 59.
Good afternoon. So with the CDC updating its guidance this week for schools, why not mandate masks in schools or set other safety restrictions for schools statewide?
That's a great question, and one we've expected. First of all, we are very strongly recommending that everyone in schools and in the state really follow the CDC recommendations with regards to masking, and that is masking students, teachers, and staff in schools at all times. I mean, when you look at it, we have, only about 34% of those individuals that are age 16 to 18 that have been vaccinated, and about 20-some percentage of the 12 to 16-year-olds. So we don't have very many students that are vaccinated. And so we are strongly recommending that. What I will say is that we are really trying to allow and have heard clearly from our local elected officials and from our schools that they want to make these decisions locally, that it's important to them to be able to make the decisions. And so, we are giving strong recommendations, strong guidance, and giving the science behind those strong recommendations and guidance, and then allowing them to make that decision.
Next question is from Brock Turner.
Hi there. I have two questions here. I know a lot of other states have required employees to receive, like state employees to receive vaccines. Is that something you've spoken to Governor Holcomb about specifically?
We have had discussions. What I will say is that we don't have the ability at the state level to even verify if we would mandate that someone get a vaccine. We can't really verify that. We're not allowed to have passports or any other way to verify that. So it's kind of a moot point. And we have continued to take the stance that we are not planning on mandating a vaccine now under the EUA.
I would just add that we provide as many opportunities as possible to our state employees to be able to get the vaccine, including having a vaccine available at our outdoor food.
The market, the open market every
yes,
week.
Every week.
So we've done several vaccine clinics right here in the government center for employees before they came back from working remotely and after they came back, and then continue to be there weekly, even just to discuss if people have questions, right? We understand that there just may be some questions and some people that want to express the barriers or concerns that they have. So we're there for either of the above.
Masking in schools. I know that you all are valuing local control here, but if the science is clear, I guess I'm confused as to why there's even a need to have local control.
I think that the state of Indiana in general is very much a state that very much feels that the control should be in the hands of the elected officials to make those decisions because they were elected by the people and for the people. And so consequently, we are being respectful of that, but I think we're making it very clear about what we are recommending.
Next question is from Eric Berman of WIBC.
Hi, good afternoon. Couple of questions. There have been reports in other states that the Delta variant has prompted a big increase in school-age children getting infected. Are we seeing anything like that in Indiana where the age of those getting COVID is younger, and particularly that unvaccinated age group?
Right, and by nature, you would see more cases there just because that's the population that is least vaccinated. So we are seeing a little bit of an increase there. We have looked at that, but there are so many factors that go into it. It's kind of hard to sort out what part of that is the fact that it's the Delta, what part is the fact that their vaccination rates are so low, and that's what we would expect.
And also want to return to the question of why a recommendation rather than a requirement on the masks. Is the department of the opinion that it is not yet serious enough to require masks, or that a requirement would not work, or is this strictly a philosophical issue of who should be in charge of making those decisions?
It may be somewhat a combination of all of that. I mean, we do believe that this is a significant increase in cases. We have looked at other countries that have had this and states, and it typically is a very, very high rise very quickly, but then it does fall off very quickly. But we have given Hoosiers the tools that they need, the information, the education, the ability to get vaccinated. We have provided that over and over and over again. And so we do believe that there comes down to some personal responsibility for Hoosiers across the state to make those decisions for themselves and in their own communities. Lindsay, do you want to add anything to that?
All right, thank you.
All right, the next question comes from Rob Burgess of the Wabash Plain Dealer.
Good afternoon. Good to be with you again here.
Thanks, Rob.
Thanks. I had two questions. My first question is, Israel is starting a third booster shot of the Pfizer vaccine in people there over 60. If you were to roll out a similar booster shot here in Indiana due to these variants, would you similarly do so in an age-based manner, or would you get everyone at the same time because the risk of transmission to others is still high, even if the effects mainly are for older people?
So we are following the data very closely about booster shots, whether it would be something recommended for everybody, whether it should be focused on people who are immunocompromised, people who are older, for example, like you said, over the age of 60. This has been discussed at the CDC level twice now on both their last immunization practice committee meetings, and we pay very close attention to those. So we know that there's more information, more data, more evidence coming. If it comes out and there is a recommendation that there be a booster shot, we are ready. We wouldn't, if they say it's for immunocompromised and people over the age of 60, we would say go, run, go get your third booster if the data and the evidence supported that.
And we would follow the recommendations from the FDA and CDC on that.
Absolutely.
Many local schools are basing their masking requirements on whether or not staff and students are vaccinated or not. So just to clarify for people, is this a HIPAA violation? Are schools allowed to ask about vaccination status as they craft their policies here?
So an individual student that is enrolled at a school, the ability to access their immunization records is available for their school nurse. So yes, they can certainly have access to whether that child has completed their measles and chickenpox and other vaccines. And that's one reason we know we're going to have to get caught up on childhood immunizations, because that's one reliance we have is on the schools to say, you after this date, if you don't get this vaccine, you will not be able to come to school. Now that does not apply to COVID, but it does to the other childhood immunizations that are required to not only protect that student, but other students.
Our next question is from Rich Nye of WTHR.
Rich, oh, there you are.
Yeah, sorry. So I think this gets the frustration of a lot of people. People who thought getting a vaccine was going to be the end to wearing a mask. Were they misled, misunderstood, or something else?
No, I don't think there was ever any intent to mislead anyone, nor do I think that we are here to say you need to mask the rest of your lives every time we hit the fall. I do think we see that it works for things like RSV that has gone up tremendously since we've stopped, and influenza. But what we are dealing with is a new variant here. And until this particular virus has been around longer and more people have been either infected with it or vaccinated for it over and over again, we'll probably continue to see pockets of outbreak like this. So the recommendations are there to protect individuals so that we can kind of layer those different mitigation things. The number one thing being vaccinated. Number two, wearing masks, washing your hands, getting tested if you're symptomatic, all those things that we've been through before. So it is hard, but what we're trying to do right now, if we had everyone go out that's not vaccinated, go out and get vaccinated, it would not affect this current rise that we have with the Delta variant. It would not be effective at this point in time to affect that. So the masks are the best way to decrease the transmission of that virus at this time.
And you mentioned off the top that the cases today are, I think, even more than we were last year at this time, or at least very comparable. The state fair was canceled last year. Is it safe to go to the state fair, and what would you tell people going to the state fair in Marion County?
It's a really good question, and I think yes, it is, because we do have many people who are vaccinated, and we know that their chance, even though they could get infected with the Delta variant, it's still much, much lower. And if they did get infected, their chance of having severe consequences is much lower. So not the burden on our hospital system and the risk of death. But I think more importantly, people know how to protect themselves. They know, for instance, if they have an immunocompromised child like Dr. Weaver does in her family, that they're going to make sure they wear their masks and they're careful. In my family, I have a new baby coming at the end of the month, and those little infants, they can't be vaccinated. So what I'm trying to do is make sure that I don't get sick and take something home to them. So I think that's where personal responsibility comes in. If you're going to go visit grandma or grandpa in a long-term care facility, even if they're fully vaccinated, put your mask on so you don't take something to them when you go visit.
Just to add, I think the other thing that's specific to the state fair is that it's largely outside, which we still know. We know a lot more about this virus now than we did last year, is that the outdoors and being outside in that, of course, well-ventilated area is still very protective.
So we have recommended masks inside and talked with the state fair people about that. Good.
All right, our next question comes from Kathy of the Ferdinand News.
Good afternoon.
Hi, Kath.
Hi. I always have these questions that are just kind of, I always think the idiot's questions, but that's what I ask. The under 12 that can't be vaccinated and they're in schools, what about the air quality in the schools? I mean, should there be other mitigating factors like, some sort of filters and things like that? And are schools doing that?
Yes, we have seen. I'm sorry, Kath, were you finished?
No, I just coughed in after that.
Okay. We have seen many schools, and that's one of the recommendations that we talked with the schools about at the end of the last school year and over the summertime about improving their air quality, putting in different filters, making sure that they had an increased turnover of air in their schools. Those are the kinds of things that hospitals do on a regular basis that really do decrease infection. We've talked about having windows open, conducting things outside as much as possible. So all of those things many, many schools have put into place.
And what about the after effects? These people that are long-termers or whatever they're calling that, the Delta variant, has there been time to see if that is having those same sort of effects on people? I know of several people who had the virus and are having, residual problems.
You want to answer that?
Yeah, sure. So I think it's too early to say specifically if the Delta variant causes more long COVID or those long-term symptoms from COVID. But we do know, again, with the increase in cases, we'll see more cases, more hospitalizations, and of course would expect to see the same long-term outcomes as the other variants. But I think we're a little bit too early, and we'll continue to monitor the data. Did you have something else?
No, just to say that's one thing we talked about with regards to the multi-system inflammatory syndrome in children. Right. Mm-hmm. We haven't seen a huge increase in cases there, but we'll be watching for that because we will have more children that are infected, and that's going to be a lag time of a good 4 to 6 weeks after those infections occur.
All right, our next question is from Brandon Smith of Indiana Public Broadcasting.
Afternoon, doctors. 2 questions. First, you talked about close contacts earlier needing to get tested regardless of vaccination status, but the definition for close contact before was close to someone for at least 15 minutes. Since we know that Delta carries a higher viral load and is more infectious, is that same definition apply?
We've not changed the definition of a close contact. The only place that's really, we've been consistently a little changed is in schools and allowed the students to be at least 3 foot or beyond rather than 6 foot as long as everybody's masked. So that's the only difference. The definition of close contact has not changed.
Okay. And then you've used the phrase personal responsibility a couple times here today. The governor used it today to defend the decision not to reimpose any statewide COVID restrictions. But given that the vaccine has been available for quite some time now and we still see half the state unvaccinated, can Hoosiers who are vaccinated really rely on personal responsibility to keep us all safe?
I think that's a very good question. I hope that as people see these cases go up with the Delta variant and see more effects, I think that people are seeing more younger people because those are the individuals that are not vaccinated. So they see more younger people in the hospital. I mean, by nature of the fact that whether Delta is more virulent or not, the more cases you have, the more hospitalizations you would have. And since more younger people are not vaccinated, it's going to be more younger people. And that starts to impact people when they see a 30-year-old, a 40-year-old, a child that's there. So I truly believe we're seeing an increase in vaccine rates. I truly believe this will continue. But I can't speak for everyone's sense of personal responsibility.
I would just like to add too that if you are fully vaccinated but are at risk because you are older, because you're immunocompromised, and we do want to encourage you to take that in consideration when you're making choices about getting into small, tight, inside, closed spaces, just for example.
Okay, our next question comes from John Russell of the IBJ.
Good afternoon. A number of large employers, particularly in healthcare and hospital settings, have issued mandates for vaccines for their employees. Are you recommending that private employers do this? And is the decision or the power to have employees get vaccinated being left on the private sector rather than on the state?
So I think I understand your question. I mean, we support healthcare facilities that are mandating vaccinations for their employees because by nature they're dealing with our most at-risk population, our most vulnerable population, whether that's in long-term care facilities or that's in a hospital with someone being ill. That being said, I think businesses have the right to mandate what they want for their employees, whether that's vaccination or the wearing of masks. We've seen some large companies come back and say, vaccinated or unvaccinated, you're going to wear masks for now. So we really leave that up to the individual businesses. I think it's a little bit different than the healthcare facilities that are in people's faces, operating on them, doing procedures on them, taking care of them at their most vulnerable times of their lives. Oh, did you have a second question?
No, thank you.
Okay, our next question is from Nikki Kelly of the Journal-Gazette.
I have 2 questions too. The first is, you mentioned in the beginning that the breakthrough deaths are largely, I think you said the mean age was in the 80s. Do you think we have immunity that's lagging in those earliest vaccinations? Are you seeing that in Indiana is the first question. And then secondly, it's obviously been 16 months with this. You guys have been dealing with this every day. Do either of you have plans to leave your posts?
She made me forget the first question.
Well, she's asking about, do we think that part of the reason it's our elderly people that are getting so sick and dying?
So they have been studying, for example, antibody after you receive the vaccine, and they do see initial where it does drop off, but then it levels off. And so that's a type of information that they're bringing, to the FDA, to the CDC, when they're talking about booster shots. I think that's an excellent question. So we vaccinated all these older people, we're seeing more breakthrough cases in them, but we haven't really seen it because of over time. It's more just because we're not surprised they are more vulnerable to this disease, unfortunately. So we'll continue to monitor. I think the other important thing to keep in mind that a lot of the studies are around antibodies, but there's other ways for our body to have immune responses to the COVID vaccine that we're unable to actually study and trend over time. So looking forward to continuing to monitor the most recent data.
I do want to reiterate what Dr. Weaver said, though, and the unfortunate 9 deaths that we've had in our long-term care facilities with the outbreak. It's heartbreaking for us to see that happen again. But the good news is that only one of those individuals was fully vaccinated. So the vaccine's working in this population, and that's what we really need to take away from this and encourage our elderly population to do. We always knew that our immune system above 60 to 65 doesn't work as well. We don't respond as well to the influenza vaccine or any other vaccines we get. And that's why we need to layer protection with them. But I do for sure know that our vaccine is showing that it is helping this population. And then as far as leaving our post, no, we're worn out, to be honest with you. We had a little bit of a down week just from the standpoint of it's hard to kind of get geared up again and, get the team fired up. I saw it on the faces of all my colleagues, and I hear it across the state and our public health people, and I really hear it from our hospital systems that are already short on staffing because they have lost so many individual nurses and respiratory therapists and medical assistants because they've just said, I can't do this anymore. And they're short-staffed. So we really need to help our hospitals out because we can get vaccinated, we can get our influenza vaccine, we could put our masks on to try to prevent the spread of some of the infections that we know will occur in the fall, and that will help to decrease the number of hospitalizations. Lindsay, you're not leaving, are you?
I'm not going anywhere. You wouldn't let me.
If she announced it now, I'd probably just leave.
All right, our final question today comes from Bing Wei from the Indy Star. You should be able to talk.
Oh, hi. This is Bing from the Indy Star. I have two questions. My first is, will state health officials consider the business restrictions like capacity limits in the future as the case we see if these cases rise, or some of the travel restrictions or recommendations that were in place last year when COVID was increasing in the state?
Yeah, I don't really remember that we had a lot of travel restrictions in the state. And at this point, there's been no discussion about doing any type of restrictions with regards to number of people that can be in certain spaces. And I never take anything off the table, but that has not been under discussion.
I'm sorry, I had said I meant advisories. And my second question is, what has changed between last year and this year? Because I heard a lot of questions about why recommendations versus requirements, and that these decisions should be made on a local level. So I'm just wondering, what's the difference between last year and this year when some of these things were required statewide? Is it because vaccinations are available?
Right. Vaccinations are available and have been available for anybody 12 and older now for quite a long time. So anybody who wanted their child to be vaccinated could get them vaccinated if they're 12 and older, and anybody themselves who wanted to be vaccinated could. We know, we have educated people, they know what they need to do to try to help prevent the spread of this infection. And it really has been made clear to us by our local elected officials that they want to be making these decisions across the state for their communities.
This concludes today's health briefing. Thank you all for attending.